What do you think's gone well in IT in this PCT?
I think there's probably a number of things that I would pick on in terms of what's gone well. I suppose we've had quite an aggressive premises programme for primary care centres. And part of that has been about how we invest in the IT infrastructure to support practices in the new builds, and I think that's made a big difference. So we're starting to put wireless networks in some of those new buildings, and we're starting to see some of the improvements that can make in terms of how the building works. Still some way to go on that, but I think that's been a step in the right direction. I think one of the other things that's beneficial in Central and Eastern Cheshire PCT, although it had its problems when we first started, is the ICT shared service. And what's that delivered? Well, part of that's been around using the ICE test ordering system so that actually there isn't all the paperwork going backwards and forwards. It's been about how we've introduced DocMan EDT into that, so that actually we start to get the flow of discharge information in a much more timely way. I think there are still real problems about quality of discharge, but actually that's not about the IT system, that's about what gets put into the system in terms of the information in the first place. Actually getting that flow of information, I think, makes a big difference at a primary care end.
What do you think could have gone better or been done better?
Okay, I mean, I think when the two PCTs merged 3-4 years ago, prior to that we'd had a big chunk of work around getting all the practices in Central Cheshire on one system, so using one main system in terms of practice systems. When the two PCTs merged, we've still got the majority of our practices on one system, but I don't think we ever really grasped the nettle and drove forward to say the right thing to do is have all our practices on one system, then we can invest and we develop, our technicians then get to understand the system in greater detail, and we can offer a much better level of support consistently across all our practices. So I would say that's been one of our weaknesses. But I think it's easy, everybody jumps on the bandwagon of saying let's pick on the national programme. And it's the easy one that you see on, anybody that goes on TV or anywhere else does, that's the biggest waste of money. Undoubtedly, you could have designed a system in a different way. Actually, I think it's about what we take local responsibility for and what we drive through and how we want to work with that. And actually, do we understand what our GPs want? Do we understand what we need to put in to make a difference for patient care and for ease of delivery of high quality care? And then actually we have to use the systems that are out there to the best of their ability. And I'm not sure we've ever really done the horizon scanning enough to be able to say what are the other options out there that we can pull in and we can link to the systems that we've got in place that really makes the delivery of IT the most sensible thing to do.
Do you think that's a local PCT problem, or do you think that's widespread throughout the country?
I think it's widespread, but I think there are good examples of innovative practice out there that we've not been very good NHS-wide at capturing and saying how do we roll that out and make that consistent for all. And I think that's not just IT. I think there are a number of areas you could pick and say you can go to this part of the country, they've got it sorted, they're working well with one supplier or with the national programme, they've done their bit of work, they've made a difference about how their working practices work, and then we've never learnt from that and we've never rolled that out and never replicated that.